welcome. I'm Mike Murphy, External Communications Principal here at MITRE. And today I'm joined remotely by Juliette Espinosa, Senior Medicare, Medicaid, and ACA Marketplace Strategist here at MITRE, and Rob Jekielek, Managing Director at the Harris Poll. So today, Juliette and Rob will be walking us through key findings of the MITRE Harris Poll survey on health insurance literacy and perception. Then we'll be back for a brief discussion of some key takeaways. So without further delay, please take it away, Juliette.
Thanks, Mike. Nice to be here today. So I want to begin by telling you a little bit about MITRE. MITRE works across government and in partnership with industry, and we tackle challenges related to safety and stability and supporting the well-being of our nation. We're nonprofit. We're chartered to work in the public interest. We don't have any owners or shareholders, and we don't compete with private industry for commercial contracts. We're an independent organization. We have independent research programs that explore new and expanded uses of technologies in service of the government. We operate 6 federally funded research and development centers, as we refer to them as FFRDCs. And these are unique organizations created by Congress, and they're meant to assist the United States government scientific research and analysis, development and acquisition, systems engineering, across multiple domains. Personally, I am part of the Health FFRDC, which serves as an objective advisor to the Department of Health and Human Services and other agencies that have similar or interconnected missions. And inside the Health FFRDC, we're really focused on transforming data and evidence base into insights for better health outcomes. How do we run the healthcare system in a way that is better for all of its stakeholders, but of course, primarily for the patients and for the health of the population as a whole. Specifically, we really try to work with HHS to amplify their strengths by applying our cross-cutting capabilities. So we have experts at MITRE from across many domains, but in healthcare, we really focus on health policy and operations across the whole healthcare landscape, integrating systems of thinking through both the systems of systems thinking and also through an equity lens, right? We're very focused on, through the President executive orders from the beginning of this year, the disproportionate impact on vulnerable communities and communities of color in the pandemic, on bringing an equity lens to all of our work in partnership with federal government. And our work really runs the gamut from looking at payment and health coverage policy to health delivery system reform. We partner with the government and, when appropriate, the private sector to try and really solve complex problems in public health, in health delivery, and health payment, and really it runs the gamut. In particular, we often help implement new legislation and help the government figure out how to take a statute passed by congressmen to help the health system and the American people and really implement it in a way that works best for, in the end, patients. Our work includes health communications, clinical informatics, interoperability, data analytics. It really runs across the whole waterfront, but ultimately our goal is to protect and promote the health and well-being of everyone who lives in this country. Specifically, that brings us why we're here today. We have worked with the Harris Poll, and we're excited to share the findings of a survey that we did really related to insurance and how insurance operates in people's lives. So what we know is that currently there's about $140 billion in medical debt that that folks in this country are carrying. A lot of that, most of that in collections, and we know the implications of that. And for a vast majority of people who end up in medical debt, they have health insurance. And the same is true for bankruptcies. The majority of bankruptcies in the United States are precipitated by a health crisis, and a large number of folks who end up in bankruptcy after a health crisis have insurance. So I personally bring a perspective as a patient. I've been a patient my whole life. All of us are patients at one point between cradle and grave, right? So we're all affected by the healthcare system. But I had severe scoliosis as a child and needed surgery, and then I'm a young cancer survivor. I was sick in my 20s. So I have seen firsthand the challenges of navigating a complex healthcare system and the financial burdens on a family or on an individual when you really get sick or you're injured. And then in my professional work, I really focus on how do you help patients understand their benefits, get enrolled in benefits, understand how they use their insurance, and then how they map that to navigating and gaining access to care. So with open enrollment well underway for Medicare, for employer-based coverage, and for the Affordable Care Act marketplaces, we think this is a perfect time to have a conversation and to talk about the work that we've done with the Harris poll. So with that, I'm going to turn it over to Rob.
Thank you for that introduction, Juliette. Also to Mike, always a pleasure to be here with MITRE. Most certainly one of the most unique high impact organizations in America, and really it's a privilege for us at the Harris poll to be working with you on this project Beyond. So the starting point for this work was a robust survey that looked at a representative sample of the U.S. public, about 2 times bigger than what's typically seen as quote unquote the gold standard. This enables us to go deeper into some demographic groups, such as looking at some of the results by things like ethnicity. We also have very good representation by the people who have insurance versus don't. So the starting point for the research really is this sense of confusion and concern, right? So one of the core findings, you have the vast majority, almost consensus of health insured individuals in the United States really expressing some level of concern about their medical bills. As Juliette explained in a lot more detail, and I think putting a much more real world and personal lens on it, healthcare in America is, it's a growing concern, obviously, for the overall system and for the economy, but also at a very personal and family-based level. So if we look at some of the key findings from which we'll unpack with a little bit more detail, so you can see the numbers behind it, there's a number of really key kind of stats to take away from this work. And as Juliette said, this is a really timely conversation because of everything happening around enrollment. Also, we're in a very kind of busy legislative cycle right now, to say the least, right? So when we look at what the survey is telling us, 4 in 10 insured Americans really say they've seen a surprise in their medical bills, right? This is certainly a problem. So whenever we're looking at the stats today, I think it's really important to think about the percentage, not just percentage of 100, but percentage of the US population, right? What we're looking at here are really good approximations of what people across America are seeing. The stats don't tell the true story, right? This is where kind of, Juliette and your expertise, I think really you can bring a lot of that to light. So most people also say, the majority of people say they only somewhat understand their insurance plans. A minority say they feel they have a really good grasp on them. Also, only a third of the people surveyed are aware that hospitals are required to post their prices online. Increasingly, you're seeing a lot of, as you're seeing people see surprise medical charges and aren't really sure what's going on. This is, clearly you can see that this is an important guidepost, and the majority of people aren't aware of it. Similarly, when we look at women who do tend to be the primary household healthcare decision makers, that's really kind of the exacerbation point for a lot of what Americans are feeling today as it pertains to insurance and healthcare coverage: stressed, confused, and anxious, in particular related to their health insurance plans. Okay. Also, when we talk with US residents, they say their insurance, they do say insurance companies have the primary responsibility for simplifying health insurance. There's some nice additional nuances to think about, especially across some younger generations. But really that is where the American public sees the emphasis going today. So we're going to dive into that in a little bit more detail. And Juliette, please do jump in. I know you have a lot of opinions to share, and not just opinions, you have a lot of expertise to share, right? I mean, I think this is for anyone who's watching this or kind of listening to us. I think as you think of an organization like MITRE, what you're really seeing are people that are highly immersed and deep in topic areas, not just at kind of a broad policy level, but really kind of in the nitty gritty of how does all this work? How do you improve outcomes? So first and foremost, the level of concern is very high. So when we think of hardship from medical bills, again, you're getting close to consensus, the vast majority, 76% overall, and very little deviation, whether you're insured or not insured, right? So insurance doesn't necessarily, just having insurance doesn't take away the stress of financial hardship. Also, go ahead, Juliette.
Yeah, so all I was going to say, just to underscore this point, is that what we're talking about is there's a really important national conversation about getting people covered who don't have insurance, and that's crucial, right? There are people who are eligible for programs and enrolled. There are people who don't have access to insurance in a way that they can comprehend or navigate currently, or the cost of insurance is too expensive for them. But then, to Rob's point, we have, once people are insured, that's not where the work ends, right? And what we see is people here who are insured, and we see this over and over, is that people insured are still very frightened and of medical bills and the size of medical bills, especially when a crisis hits. It's an ongoing source of concern, and so we'll talk more about different policies that the federal government is putting in place to try and address that. But it really pops out over and over again in the data, and we see it here, that this concern and the fear around how much will things cost and how will I carry those costs, it's not just an issue for the uninsured. It is very much an issue alive and vital in the insured population as well.
Yeah, and building on the point, if you look at the right-hand side, you can also see very large proportions of the U.S. public, getting an unexpected surprise, if you will, right? Whether that's around a larger bill or an unexpected bill, or around, something around the network and ending up at a doctor facility who's out of network and not being aware of it, right? So many of us have heard these stories. This is where it comes from, right? These are really high proportions of the U.S. public that are hitting these big issues, and it's a problem both with those who have health insurance as well as Medicare. So when we look at understanding of a variety of different things, one of the key callouts is, when we look at our health insurance plan overall, that's the biggest group that say they only somewhat understand their plan. You only have about a third who say they really have their head around what's going on and how their plan works, right? But in general, what you can see is for most of these things that we're looking at in terms of understanding your health insurance plan, you have the minority saying they completely understand it or understand it very well. And that ranges from copays to prescriptions that are covered, to preventative care that's covered, to things like deductibles. So in general, it looks like finding a doctor in network is better. But again, if you're assuming that everybody needs to have a primary care physician and needs to have one, and cover their family, that's still not, those numbers don't pop off the page as being particularly strong or confident, if you will.
Yeah, and I really think that a lot of what we're seeing in this survey really can serve as a call to action around health insurance literacy. And what we see is that even when a family or an individual is able to kind of navigate, okay, I have strep throat and I need an antibiotic, or my kid hurt his or her knee during soccer, and I know what to do to get that care. Right, when someone gets diagnosed with cancer or with a chronic condition like diabetes, or maybe with multiple health issues across an individual or a family, right, things get much more complicated in terms of finding the right providers, managing all of the bills, managing the lab tests and the imaging and the things that go along with dealing with serious health issues, whether they're conditions like diabetes or cancer, or whether they're injuries. And so to me, I look at this number and I think, okay, 33% of people probably do feel pretty confident. I can find a doctor. I kind of understand my copays. I sort of understand what's gonna happen to me at the pharmacy counter. But it's really, for the population of people who get very ill or become chronically ill or have a serious injury happen to them or a loved one, it gets far more complex. And the navigation of the system and the unexpected bills and the lack of ability to anticipate what's going to happen with coverage becomes a secondary trauma and stressor for people. And that's reported over and over again. So part of what we're talking about is, of course, coverage and access, but part of what we're talking about is also a humanizing of the system that recognizes it's a system that has to serve people when they are most vulnerable, when they are at their kind of lowest ebb, and when they're afraid, not feeling well, worried about a loved one, and that's when the complexity really becomes a burden. And people who maybe in the survey said to the Harris poll, oh, I totally have this covered, when they get moved into a more difficult set of circumstances, all of a sudden it becomes far more complicated. And we hear that over and over, and we see it in the data.
Important top line stat. As we look at the percentage of U.S. residents of Americans who are aware of the fact that hospitals are required to list prices publicly on their website, what you see is a big minority, right? Over 2/3 or exactly 2/3 of U.S. residents saying they're not aware, right? Again, also as you start, as we probe further and ask, knowing that this is true and something that should be in place, how likely are you to look it up? The vast majority say they would look it up, right? So lacking information, but a high degree of interest in finding out more.
Yeah, so price transparency has been a challenge for decades, right? There's general consensus that it would be better for patients to understand how much things will cost and what their share of those costs will be. So you're right, there's a very high demand for this information, and new policies that over the last few years out of the federal government have tried to promote price transparency. There's been some issues with hospitals and providers figuring out how to comply and then complying. And there's also the issue of, once the information is up there, is it in a form that a layperson can understand, a patient or consumer can understand? But you're absolutely right. There's a huge appetite for this information. And once I think we get it right and the stakeholders are able to share the information that the federal government has asked them to, then it's really about, again, how do we empower patients and their families and their networks of caregivers to use this information to help anticipate and plan for the care that they need. And I think that's really what we're talking about, is knowing in advance, okay, I'm going into surgery, I have to understand what it's going to look like in terms of the care I need and the recovery time, and what's happening with work and what's happening with childcare, but also what are the bills going to look like? And not knowing that in most instances today in the United States until well after you've gotten the care is part of what these new policies are trying to address. So it is a really kind of exciting and energetic time around that.
Agreed. One additional highlight, just to build on what Juliette was saying. So right now you do see some higher percentages, namely with people with higher education and people who generations that are more inherently kind of digital savvy, have grown up in the digital age, feeling more aware and more informed. So you get the sense that some of this information is being posted, but it's not necessarily pulling through to especially audiences that may actually need the information even more and may not be as technologically savvy. So certainly, some momentum building, but a lot of work to do. We also dug in a little bit deeper in terms of understanding, what percent of the time Americans check to see if something is covered or not before proceeding, right? And what we generally see is that 39% on average actually do check for coverage, but at the same time they still do get frustrated by a variety of things that that are hard for them to figure out, namely trying to figure out what is and what isn't covered, right? The number one frustration point, and I'm sure everyone personally has had this to some degree, is really kind of figuring out what's covered versus what's not, especially if you're looking for something beyond just a preventative primary care visit.
Yeah, and I think another big piece of this puzzle, right, when you say, oh, 3 in 10 admit they never check coverage, one thing that's worth observing is someone might in the past have tried to check coverage and it was so frustrating, or they couldn't get the information that they needed, or they got misinformation, that they tend to not check again, because when they check, the information they got wasn't particularly helpful or clarifying. And that when you do try and check, right, you often get on the phone with an insurance company or a plan administrator, and they say right away, like, just talking to me isn't a guarantee of benefits, right? There are legal documents, these are contracts, and we need to be able to translate what the plans say. And I understand they have to have a certain level of complexity in order to be kind of properly designed and to operate. But we need a way, again, to translate this information in an accessible fashion to patients. And I was telling Mike the other day, right, I teach at George Washington University and was on faculty there before coming to MITRE. And even among a department of colleagues who work in health policy, there was confusion around the options, right, for that year's open enrollment. And as an insurance subject matter expert, and patient advocate, I was trying to explain what they could anticipate and how they could understand their benefits. So it's inherently rather opaque and counterintuitive to try and understand benefits sometimes. I think we're seeing better and better tools coming out of both insurance companies, patient advocacy groups, and from providers, but we really have a long way to go for people to understand in an intuitive way what's covered. If it's not covered, why isn't it covered, and is that okay? Is that legal? And then what piece of my care am I going to have to pay for, and how much will that be? So I think this is a really interesting and important finding.
Yeah, and it's also has to be onus on consumers as well. So the fact that 3 in 10 have never checked their coverage also is problematic, right? It's a bit of a set and forget it. Like it is important to reinforce kind of understanding what's in your plan, as well as just having one.
And I would agree. The one thing I would say in response to that, which I think is important, is if you try and give people the tools to actually understand what their plans say, that's one thing. But for lots of folks, they try and find this information out, and it's really, really challenging. And so there's a kind of understanding among people that, I don't know how to do that, so I'm not going to do that. And that doesn't mean that they shouldn't be doing it. It doesn't mean that there shouldn't be a way for them to understand what's covered and be checking, right? And that they have a role to play in this. We all have a role to play in it. The patients, right? The people who love and support and care for those patients, the insurance companies, the providers, the government. So, but I think we can expect more and we can ask more of patients and consumers when we give them the tools that they need.
Absolutely. Women are an important hotspot when you think of what we're seeing in the results today. So most certainly, a lot of the real world data indicates that women still are the primary healthcare decision makers in most families. When we look at the scenario that they're kind of living in and are surrounded by, you can see today they certainly are there are exacerbation points in terms of how they're feeling, primarily around feeling stressed, confused, and anxious, as well as less confident, feeling less knowledgeable, less in control, and less calm versus men, right? So a kind of a critical inflection point as we look at the impact of the current system and insurance programs and how they play out in terms of people's lives.
Yeah, and I think it's important to underscore here what we know from the data is that oftentimes women in whatever configuration of a family that you live in often take the lead in making doctor's appointments and making sure that people can get to those appointments and follow through with the care that they need. They're getting the explanations of benefits from the insurance company. They're opening the bills from the hospital or provider and maybe finding errors and on the phone and trying to figure this out. And so they're living this experience through the year of using their plan, and then they go into the kind of plan selection mode during open enrollment, and some of them are really trying to solve or prevent problems that they've had in the past year. And how do you do that? How do you choose a plan that's going to spare you maybe some of the difficulties you had? How do you know that you can absolutely trust and rely on a list of in-network providers because you want to keep the same pediatrician for your child, or the same psychiatrist for your husband who is on some medication for mental illness, or you're in a continuation of care and observation with a specific chemotherapist, or oncologist. So I think what we see in these numbers is, women kind of navigating the system for themselves and on behalf of their loved ones, and so they're internalizing the stress, and they're trying to find kind of a pathway to a better experience during open enrollment, and so we see this frustration expressed and this anxiety.
So as we also dig into where American residents, where the public puts primary responsibility on simplifying the system, what you can see is the largest proportion is certainly towards insurance companies, 45%, followed by healthcare providers, the government, employers, as well as healthcare advocacy groups. As we look to the right-hand side and how this breaks out by generation, you can also see some important and noteworthy underlying trends. So especially when you look at that insurance company responsibility, it's a standout element with older generations, right? So thinking, again, boomer age, if you will. As we go down towards, for example, the government, which is interesting, as well as healthcare providers to some degree, you see a little bit of an inversion where you see younger generations putting more of the responsibility versus other generations there. But again, you get a clear picture of where the current, ease is, responsibility for ease is placed, but you also do see some significant shifts as we look at some of the underlying demographics.
Yeah, and I think if you step back, right, this makes a lot of sense, right? First, insurance companies, generally for-profit entities, and this is how they're making their money, right? So, and we're paying premiums into these companies. They're designing these plans. They're administering the plans. So people really feel like the insurance company should explain stuff to them, right? That we're paying them for a service, and we want to know how to utilize our healthcare. They're the intermediary. So looking to them makes a lot of sense. I would just say when you look at the shift in age, right, we think about the passage of the Affordable Care Act in 2010, and we think about the changes that have happened over the last decade or more around looking to bring providers into alternative payment systems and mechanisms separate from fee-for-service, right? So it becomes part of a national conversation that younger people have heard more and more, for the government to step in, for providers to be part of the solution for fixing what's broken in healthcare. And so it's not surprising at all that the younger generation has seen more vocalization by the government and from providers around these issues than the previous generations had seen. Makes a lot of sense.
Yeah, no, it's a really interesting trend. And the Gen Z piece, I think, is particularly relevant to the point you just made there, Juliette, where to a large degree, you've seen a significant change in discourse over the last decade in terms of the roles that other folks play. And in many cases, Gen Z is not, they're more of the people who are listening and being informed, and maybe not as much users yet. So that is a very interesting paradigm, but a very noteworthy one when you think of the role of government and healthcare providers and the expectation that younger generations have.
Well, excellent. I think that was our last slide. Rob and Juliette, thank you so much for that. I know we've got some time for some questions. So I think off the bat, Juliette, you talked about not only working in the space for quite a while, but living in the space for quite a while. So I'm curious, what from the survey research and findings has really caught your eye and maybe surprised you?
Well, I think the appetite and the demand for prices isn't surprising, but I think it's a heartening reflection of kind of the shift in how we're talking about healthcare in this country, right? The Affordable Care Act was really focused on getting people covered in large part. It did a lot of other stuff too, but really getting people who didn't have access to coverage covered. And the conversation has shifted to really, how do we understand why healthcare costs so much? How do we understand why patients are carrying a larger burden of those costs over as the decades have passed, and how do we manage creating a system that allows people to get the care they need in a way that is intuitive, or at least in a way that meets their need when it happens, right? If you get a negative test result, if you get an unexpected bill in the mail, right, the ability to kind of say, where do I go to fix this? Who do I call? How do I understand in advance how to plan, right? So to me, the demand for more information, I think, is a trend that we've been seeing, and it's part of the national dialogue. But also, again, it's where Rob really started, right? The vast majority of people are worried about how they're going to pay their medical bills. And it's equally true for people with insurance and without, right? Those are fundamentally different challenges. To be entirely uninsured and unplugged from the system is an issue that we need to solve for every uninsured American, every uninsured person in the country. But at the same time, for people who are lucky enough to have coverage, not all coverage is created equal. Not all access to care is the same. It really is driven by the kind of plan you have. Are you on Medicaid? Are you in Medicare? Are you getting insurance through your job? Are you on a marketplace plan? Your rights under those plans are very different. The kinds of coverage, the level of financial burden is very different population to population. They all have their own challenges. So seeing this number that, to me, is the headline that we started with, is really kind of a clarion call to what needs to be done in terms of addressing what we are the known policy issues about why people live in such trepidation and then under such enormous debt burden after being sick. We need to address that. And then at the same time, it shows us that there are things that we can do in the policy world, that stakeholders can do as providers and payers, that the government can do to collectively work together to really try and repair the system. And that's where a lot of the new policies we've seen this past year, 2 years even, are starting to move us, whether it's price transparency or the new ban on surprise billing. These are big moves to really try and strengthen patients' rights, and also, to Rob's point, empower patients and their loved ones to be engaged in their own healthcare, in navigating the healthcare system, and in understanding how the system works. But it is a counterintuitive system that makes a lot of people kind of immediately shut down. I know as a professor, when I start teaching insurance, I first have to convince the students, as I hope I can convince the audience watching this. It may be boring to some, but it's so crucial and important. And when it hits your life, right, when it's about, can I pay my mortgage, or can I pay my oncologist? Is it, can I get my kid in to see that specialist? Oh, not for 4 months. What am I going to do? My kid is sick, right? These are like vital issues, like about our core humanity and about our ability to take care of ourselves and the people we love, and to feel safe in our homes and in our jobs. And I mean, so it's super personal, but also from a policy perspective, just incredibly complex.
That's great. I mean, Rob, similar question to you. I mean, you live in the research world, you live in data. When you started, looking at these findings, I'm curious what caught your eye.
I mean, one of the things that I always get pulled to right now are the generational differences in things, right? And I think it's both. We're seeing the overall continued level of complexity, impact, stress, concern. At the same time, I think there's increasingly, you're starting to see better solutions emerge to simplify things, but we're at the starting point, not at the end, right? So I think when you look at different generational expectations on who's responsible, you still do see insurance companies as the primary. And that's where maybe much of the digital health kind of innovation, if you will, is starting to happen. But I think, as everybody knows, the whole kind of like connecting the dots in the healthcare system, interoperability, there's like really, really big problems in the system, very big complexities. And I think, we're hopefully at this inflection point where you're going to start seeing more simplicity and more ease continue to emerge. And it's a huge opportunity, but again, because you now have a lot of, increasing large parts of the population that are technologically savvy. The big concern as you're looking at that trend forward, and you have a sense of optimism, is ensuring that people who aren't as digitally savvy, but are, maybe have the biggest impact points on the system and from the system are, they're not left behind, right? So a high sense of optimism, a lot of work to do, and just really, when you look at the data here, just how do you ensure that, people who aren't as digitally savvy don't get left behind?
Thank you. Juliette, Juliette, following on to something you mentioned just a couple minutes ago about surprise billing. I wonder if you could just give us a sense of kind of how prevalent that is, and maybe some tips or some guidance to folks about how to, avoid getting the envelope in the mail with the surprise.
Sure. So, so this is kind of a good news part of what we're talking about this year. In December of 2020, there was a new piece of legislation passed called the No Surprises Act, bipartisan piece of legislation designed to protect people from surprise bills, which are bills that you get from out-of-network providers, even though you think you're at an in-network facility, or that you might get in the course of getting emergency care where you weren't even cognizant and able to direct where you're going to get your care and how, because you were in a car accident or you collapsed. And so this new law goes into effect January 1st of this coming year, 2022. And the goal is to really protect patients from these, quote, surprise bills, which is really different from getting a bill for something that isn't covered by your plan, right? And surprise bills, these out-of-network charges, they run in the billions and billions of dollars. They're clearly part of this $140 billion medical debt that the country is carrying. And this law was really designed to stop some of the known kind of regular sources of those surprise bills and give patients the ability to then, where appropriate, make an open-eyed choice and consent to go out of network or to take on a bill or to take on a service that isn't covered by their insurance. So, so I think it's important that people know that the No Surprises Act passed, that's going into place in January of 2022. But again, it's not enough to simply have coverage. It's not enough to simply have policies and laws that try and empower and protect patients. But patients have to know that they exist. They have to know what their rights are. They have to know when they open that bill that there's a chance that they shouldn't have gotten it in the first place. So we have a lot to do in raising consciousness around what people's rights are with insurance. To Rob's point, how you know what your coverage is. And then when you get these bills, right, and we know the error rate from hospital bills and bills from providers can be very, very high. In some studies, up to 50% errors on a given bill. And we know that there's errors in the claims processing that goes on in insurance companies. So you have patients kind of caught in the middle. So this is a major piece of federal legislation that's really trying to remove patients from the complexity of those disputes and protect them from these surprise out-of-network bills. And that is a huge step forward. I mean, as a patient advocate, I've worked with literally hundreds of people bringing me these bills, trying to figure out the source of them and why there's so much. They can be thousands and thousands of dollars. And so to have that unanticipated cost on top of being ill, on top of everything we've talked about in this call, right? So it's a nice ray of sunshine, coming down the path. We just have to make sure that advocates and patients and providers and insurance companies understand how it's supposed to work, and that we actually end up bringing relief to people.
Thank you. I mean, something you mentioned in your opening, in your introduction about open enrollment. We're certainly in the midst of open enrollment as we have this conversation. I'm curious what recommendations you might make to friends, family, or the audience today about making their elections during open enrollment.
Yeah, and I think that's a great question. And I mean, my entire career is anchored in insurance, and I still was last night sitting with my wife, incredibly stressed, looking at her benefits versus my benefits and which should we choose. And of course, you want to look at all of the regular indicators. What percentage of things are covered? Do you have in-network and out-of-network benefits available to you? What are the deductibles? If you have employer-based coverage, right, you have a little bit of a cushion from premiums because your employer helps you out. If you're going through the marketplaces, in the Affordable Care Act marketplaces, right, a lot of people choose the cheapest plan, the least amount of money out of pocket, but then they end up having a higher exposure to the cost of care later on, right? Because the lower cost plans have what we call a lower actuarial value, so they're going to cover less of your care. So there are a huge number of navigators that this administration has funded an enormous amount of navigation resources out there. There's your HR department if it's through your employer. There's the Medicare Rights Center if you're grappling with Medicare enrollment. There are, and the government itself has enormous resources and hotlines to call for things related to Medicaid at the state level and to Medicare at the federal level. So, but really you want to understand as best you can when you choose a plan, are the doctors I'm seeing doctors I'll be able to continue to see? So looking at those network providers, the lists and making sure that the people that you rely on right now for care, you're not going to have to kind of switch to someone new all of a sudden if that's a big concern. What are the deductibles? How much do I have to pay out of pocket first before I'm able to get medical needs covered? So, and it can be daunting, but there, during open enrollment specifically, there are a lot of resources available to folks. I really want to encourage you to avail yourself of them and not try and process the information without another set of eyes. Even I need to verify, am I looking at this right? Is this the right choice? Right, and I live and breathe insurance day to day. So it's by default relatively complex. At the same time, I think HR departments, Medicare and Medicaid, the marketplaces have really worked hard to give people information they can understand and process so they can really compare plans and think about their benefits during open enrollment. So now is the time to ask your questions and lean in and find the advocates in your environment who are there to really help you, because it can be daunting.
Oh, I appreciate that. Well, I think that's all the time we have for today. Maybe some final thoughts on the topic. Maybe start with you, Rob, and then Juliette, take us home.
Yeah, I mean, I think it's, I think we've covered the topic in a lot of detail. I would certainly, every time we've had a couple of these conversations, every time I listen to Juliette talk about a lot of these topics, I certainly learn something. So, really appreciate being part of the discussion today. It is a really important topic that has really big implications that are both at the system level as well as at the personal level or in family level. So, happy to be part of the conversation and hopefully helping move the agenda forward.
Yeah, and I think all I would say to wrap up, Mike, is that when we look at the work that the Harris poll did with us, and it was wonderful to work with you all, I think the headline that comes out for me that we talked a lot about is we really have a lot of work to do in terms of educating people and building into how we operate our healthcare system, health literacy, and health insurance literacy in particular, and then giving people the information and the tools that they need to really plan when they need to engage with the healthcare system and get care. So I think the headline is getting covered isn't the end of the story, right? We have to get everyone covered. Once you're covered, right, we really need to work a lot harder at a national level to empower patients to understand the coverage they have and how to use it. And then on top of it, to look at all of these new policies that the federal government is putting in place and make sure that people know what they are and understand them so that they can access price information, they can fight a surprise bill. So there's a lot to be done, but I also think to the point that Rob made earlier and that you said, we're kind of at an inflection point. Things are shifting, and I think we have an opportunity to really to focus our energy on bringing the patient experience in and helping that inform how we're going to make it easier and more intuitive to navigate this system and not, as I said at the beginning, impose on people at their most vulnerable moments when they are the most worried about a loved one or themselves in terms of their own physical well-being. We're not going to give them a secondary trauma of the complexities of navigating insurance coverage and accessing the care that they have benefits for. I think we can do this in a more humane way with all of the moving parts that we have in place. So that's really what I hope we're able to do in the coming years.
Great conversation. I want to thank you both, Rob, Juliette, thank you so much. A news release is available on our website, mitre.org, or you can email us at media@mitre.org. Thanks for joining.